Hello everyone, I am Dr. Tariq Bhatt. I am a diabetologist. Today I am going to discuss the essential aspects of polycystic ovarian syndrome or PCOS. PCOS is one of the leading causes of infertility in women of childbearing age. This picture clearly shows the difference between normal and polycystic ovaries. On left side of this slide you can see that ovary is filled with multiple cysts, and that's the reason the name was given as polycystic ovary. 1 in 10 women of childbearing age are affected by PCOS. 5 to 18% of women have PCOS worldwide, but 50% of women do not know that they are suffering from PCOS. 70% of women with PCOS have difficulty getting pregnant. 20 to 30% women with PCOS develop diabetes. Well, the exact cause of PCOS is not known, but many factors play a role. Genetics. PCOS is seen that it runs in families. There is insulin resistance, which plays a major role. Hormonal imbalance. Coming to hormonal imbalance, it has been seen that females with PCOS, they have increased production of luteinizing hormone or LH. Normally, all females, they produce small amount of male hormone that's known as testosterone. High levels of luteinizing hormone in females with PCOS increases testosterone levels, which causes increased facial hair growth. There is acne and hair loss. This combination of high LH and testosterone, they impair the development of eggs in the ovaries. Also, females with PCOS, they have decreased levels of another important hormone known as FSH or follicular stimulating hormone. This prevents eggs from reaching maturity. Now, there are a lot of immature eggs and they start accumulating in the ovary, which appear as cysts. And this cyst, they appear as dark circles on ultrasonography. What are the clinical features of polycystic ovarian syndrome? The main issue with polycystic ovarian syndrome is abnormal ovulation. In that, there may be oligomenorrhea. That means when a female has less than 9 periods in a year. There can be amenorrhea, that means no periods for 6 months, or infertility. As we saw that there is increased testosterone levels, there is high androgen levels, these high androgen levels, they cause high androgen symptoms. Hirsutism, there is increased hair growth, particularly on facial. There can be acne, or we call it simply as pimples. There can be seborrhea, or we call it as dandruff. There can be alopecia. Now, alopecia is loss of hair, but the particular thing about polycystic ovarian syndrome is loss of hair, which is male type of baldness. So that is typical feature of PCOS. Insulin resistance is one of the common causes for PCOS. Insulin resistance means when there is a resistance to the actions of hormone insulin. Now, because of this resistance, the body produces extra insulin to compensate. Well, high insulin levels, they cause ovaries to produce more testosterone, which will again impair ovulation. Well, insulin resistance can lead to weight gain, which will further worsen polycystic ovarian syndrome. We can diagnose this insulin resistance clinically. Very simple. If you check your groin, you check your armpit, or you check your back of the neck, and there is a black discoloration, and if you touch it, it will be velvety feel. This is called as acanthosis nigricans, which is a marker of insulin resistance. Obesity is another leading cause for polycystic ovarian syndrome. Again, there is insulin resistance in obesity. How to diagnose polycystic ovarian syndrome? Main is clinical features. The topmost clinical features include irregular periods, high androgen symptoms, which we saw previously, hirsutism, acne, alopecia, or polycystic ovaries on ultrasonography. So if any female who has two symptoms out of these three, we can label her as a case of PCOS. We can do lab test also. We can see testosterone levels, they will be decreased. SHBG levels, they will be decreased. Luteinizing hormone, it will be increased. FSH, it will be decreased. And the ratio between LH and FSH will be increased. And to see fasting insulin levels, which will prove insulin resistance, it will be increased. Ultrasonography, it adds to the diagnosis of polycystic ovarian syndrome, but it is not compulsory to label a person as a case of polycystic ovarian syndrome, because almost 25% of females have been seen that they have cyst on ultrasound, but they are not a case of polycystic ovarian syndrome. How to manage polycystic ovarian syndrome is lifestyle modification. We have to advise a female with PCOS to have healthy and balanced diet. She should avoid processed food, simple sugars, and saturated fats. Regular exercise is very important, particularly aerobic activities such as running, swimming, and cycling. It will improve insulin resistance. Stress management very important, and adequate sleep is very important for managing polycystic ovarian syndrome. Medical management, we should always treat individually. The treatment should be individualized. The goals of the treatment should be, first important thing is treating infertility. Then we have to regulate periods for endometrial protection. We have to control high androgen symptoms like hirsutism, acne. Females who do not wish to get pregnant, we can advise them to take birth control pills. These are very important part of treatment. They will regulate periods. They will prevent development of endometrial cancer. They will reduce acne and hair growth. For females who wish to get pregnant, for them the drug of choice is clomiphene. It will improve the ovulation, which will help in pregnancy. Metformin, it helps us in indirect way by reducing insulin resistance, which will reduce androgen levels, which will regulate periods, and it will also control blood glucose levels. Thank you so much.